these drugs that we are talking about, and yesterday we have talked about is non-steroidal anti-inflammatory drug. And so today we are talking about just a quick review of yesterday's presentation about the non-steroidal anti-inflammatory drugs, and why I'm repeating the things from time to time, because uh, you should have some clear image in your mind about the subject. So that these are the drugs, and yes, everybody should know the drugs. If you claim that you want to be a doctor and you could not know the name of aspirin or the ibuprofen or mefenamic acid or indomethacin or phenylbutazone or oxycam, palacticam, so I think your doctorate is zero. You are zero. चाहे आप कितने भी होशियार क्यों ना हो, extraordinary क्यों ना हो, लेकिन if you don't know the drugs, nobody will accept you as a doctor. So these name of these drugs, they are very important, and everybody should know the name of these drugs. And the questions, they are sometimes, but all the times they arises by the name of the drugs. Okay, so wrong. So this is the pharmacological effects we have discussed. That is the anti-inflammatory effect, one of the most important and on the top. Pharmacological effect of these drugs, that is anti-inflammatory effect. There's a cell membrane. Again, I use the word stimulus when there is a stimulus. We have discussed yesterday that what is the what sort of stimulus is. So it activates the enzyme, that is the phospholipase A2. And yesterday somebody has raised the question about this prostaglandins and the phospholipase A2. So first, in response to the stimulus, there will be the activation of the phospholipase A2, which act on the phospholipids which are present in the cell membrane and convert those lipids into the arachidonic acid. And this arachidonic acid has two enzyme systems. One is cyclooxygenase and another is the lipooxygenase. The things are very simple. I think इसमें कोई इतना वो problem है नहीं कि आपको जो problem हो. And when the cyclooxygenase enzyme is acting on this arachidonic acid, then this cyclooxygenase enzyme is converted into the prostaglandins and prostacyclin, and there will be the thromboxane A2. And when this lipooxygenase is acting on the arachidonic acid, it converts into the leukotrienes. So leukotrienes has an important place in the bronchial asthma. So when we will talk about the bronchial asthma, then we will talk about these leukotrienes. As far as the inflammatory system or process is concerned, these prostaglandins, they are very much important. And all the signs and symptoms that we have discussed yesterday, that is the redness, swelling, pain, and temperature, they are all because of the vasodilation which is produced by the prostaglandins. So what these drugs they are doing as an anti-inflammatory, they just block the cyclooxygenase enzyme. And yesterday I have given you the concept regarding the blockage of the enzyme. Where there is the blockage of the enzyme by any drug, what would be the drug if it is acting by blocking the enzyme? It's very much clear to all my dear students that it either something is being deleted from the chemistry of the enzyme or something is being added to the chemistry of the enzyme. So the substrate of the enzyme is being changed, and that the cyclooxygenase enzyme will not be able to act on the arachidonic acid and will not be converted into the prostaglandins. And Kalbi, yesterday I have told you that our reference point in non-steroidal anti-inflammatory drugs should be around and around the cyclooxygenase enzyme and prostaglandins, whether it is pharmacological effects, whether it is side effects. Today we will discuss the side effects, and you'll see how these prostaglandin is very much important again in the side effects. Acha. Then a pain relieving effect. Don't say the pain relieving. I'm using the word because I want to give you the rough definition of the analgesic drugs, but from today, nobody will talk about the pain relieving drugs. No way. That is the analgesics. Those drugs to relieve the pain, they are called as the analgesics, and the pharmacological effect is analgesic, which relieves the pain. A pain sensations, which means very simple. These pain sensations have been carried out by the specialized type of the receptors who are known as the nociceptors. This is the stimulus for the inflammation. What could be the stimulus? It causes the increased availability of the prostaglandins because of the activity of the cyclooxygenase enzyme over arachidonic acid. So when there is a plenty availability of the of this prostaglandins, then it increases the sensitivity of the nociceptors. So this pain carrying capacity or the sensitivity of receptor is being enhanced, it is being augmented or increased. So the low threshold blood pain stimulus, they are being carried up to the brain and we feel the pain. So if you use such sort of drugs which inhabits the cyclooxygenase enzyme, they decreases the availability of prostaglandins, so they decreases the sensitivity of nociceptors, so they decreases the pain carrying capacity to the brain, and we feel the analgesic effect or the relief from this pain. Another is the antipyretic. Paresis means the fever. Fever means the increased body temperature from the normal. When the body temperature increased from the normal, then we call it as the paresis, and those drugs will relieve this fever. We call it as the antipyretic. Again, I have told you that we have the thermostat in the brain, and we have the two systems, that is the heat generating system, we generate the heat, that is the metabolic systems, and that is the skeletal muscle contraction system. And we have the heat losing system. Obviously, we don't go into details, but the important point should be noted that sweating is the best way to exhaust the heat. And so when in the and our set point that is 37 degrees centigrade. So our body temperature maintains at the 37 degrees centigrade. In cold season, when the external environment is cold and our body temperature goes beyond the 37 degrees centigrade. Yesterday, some students have raised the question, sir, why the heat losing and heat generating system, they are not working when the thermostat raised up to 39. Beta thermostat set point का मतलब ही यही है. It means that your body temperature when disturbs beyond 37, then it works. When it is below 37, then it works and it generates the heat and it sends the messages to the muscles that my body temperature is going down. So please start generating the heat. And in response to that feedback, there are the rhythmic contractions of the skeletal muscles and they generate the heat. We call it as the shivering. We call it as a shivering. When the temperature is going beyond the 37 degrees centigrade, then there are these signals they are transmitting from the brain that my body temperature is going up. It's going up. And please do something for my body temperature. Then what happens, that is the feedback system, they are being generated and there will be the excessive sweating and our body temperature goes down. So you should keep in mind that the set point means when there is the disturbance in the temperature, the positive or the negative, then this feedback system is working. Then this feedback system is working. Otherwise, it is not working. So if your set point is raised up above the 37 degrees centigrade, so from 37, for example, it is set at the 39. So this feedback system will not work up to 39. When your body temperature goes beyond the 39 or goes below the 39, then the feedback messages, they are being creating and sending to the feedback system that now my body temperature is going beyond 39 degrees centigrade, so please do something for my body. That's why our body conserves the heat. Consume नहीं, somebody was talking about the consume. कोई भी चीज अगर consume होगी, if you consume something, तो it causes the deficiency of that thing. So if the body consumes the heat, then there must be the deficiency of the heat. It's not to consume the heat, it conserves the heat, it stores the heat. So when the body stores the heat, then the body temperature goes up, and then it causes the fever, raised body temperature. And when we go for such sort of drugs who blocks, and this is again due to the increased plenty availability of prostaglandins. Yesterday we have talked about. So when you are getting such sort of drugs, ibuprofen, aspirin, paracetamol, methylphenic acid, so there will be the decrease in the synthesis of prostaglandins, and the set point goes back to normal or near normal. It causes the sweating, or the stored body heat is being exhausted out, and we feel perspiration, and our body temperature comes down. Okay, so, and this is the antiplatelet effect. I don't know why you have, somebody has queries about this antiplatelet effect. अब ये तो एक तो ये स्टेटमेंट है is not correct. So हाँ, हर साल मैं सोचता हूँ कि इसको मैं correct करता हूँ, लेकिन मैं always I missed it. It's not the antiplatelet effect, it is the antiplatelet aggregation effect. So I have to put the word aggregation. Definitely when I will upload my lecture on the YouTube, I will add the aggregation. It's very important. Aggregation means clumping of platelet over the platelet. 1, 2, 3, 4, 5, 6 million, trillion, that platelet, the plug. This is called the aggregation. And in this aggregation is again due to the prostaglandin. And again, when there is any trauma is one stimulus for the inflammation. So when there is a trauma, so there is release of this prostaglandins, and there are the intravascular bleeding spots, and that platelet aggregation causes the plugging of that you see the bleeding spots, and we don't bleed. This is called the platelet aggregation. But what is the side effect of this platelet aggregation? That this aggregation causes the blood clot. Not only the platelet aggregation, but when there is the aggregation of platelet, there will be the accumulation of the fat, cholesterol over that clot, and they form the thrombus. Thrombus का मतलब ये है कि this clot is being detached from these walls and is now circulating in the blood. ये आप पढ़ोगे अभी इसमें pathology में what is the thrombosis and what is the embolism. So when this clot is being detached from this blood vessel and then circulating in the blood, it causes the embolism. That is circulating clot. Whenever it plugs any small blood vessels, the blood supply to that particular organ is being interfered or blocked. And as the blood vessels of the cardiac muscles, they are very minute. So when it plugs that particular blood vessels, minute blood vessels of the myocardium, they causes the infarction of that particular area of the heart, that we call it as the myocardial infarction. The only way to prevent this myocardial infarction is to prevent the formation of this clot. The first initial step in the formation of this clot is the aggregation of platelets. And we only inhibit the platelet aggregation by inhibiting the prostaglandins. And we have the way out that we use. This indication is only for the aspirin. We use the aspirin prophylactically to prevent the myocardial infarction, to prevent the cardiac events and heart attack, because they inhibit the cyclooxygenase enzyme, they decreases the availability of prostaglandins, so they prevent the clot formation by inhibition of the platelet aggregation. In this way, we can prevent the incidence of the myocardial infarction, and this is very commonly used. Why only aspirin? I have told you, because aspirin is irreversibly bind with the cyclooxygenase enzyme. When it binds with the cyclooxygenase enzyme, it inactivates the cyclooxygenase enzyme. Then this inhibition is remaining for 4 to 5 days. Yesterday, somebody was talking about 5 to 10 days. 10 days, nahi beta, 4 to 5 days. That's why if you want to operate someone and he or she is on the aspirin therapy, you must stop the aspirin therapy 7 days before his or her operative procedure. Otherwise, you will be in a great, you will danger the patient by bleeding tendency. Blood clotting to hogi nahi, there will be no blood clotting, because you are going to abolish the platelet aggregation by inhibiting the prostaglandins. So it will create a big problem of the hemorrhage to that patient if you operate it while having this aspirin. And if your patient is being operated, you should not administer the aspirin right on the second or third day after the surgical procedure. It should be after 7 days, when there's a proper healing is there and everything is normal. Then you could start with the aspirin. Otherwise, again, you will create the post-operative complication. So this is all about this platelet aggregation. As a last time, yesterday I have told you that what is actually the enzyme inhibition. मैंने आपको कहा था yesterday कि किसी और का, if you don't remember the chemical name of any drug, at least you should remember the chemical name of aspirin, that is acetyl salicylic acid. Because why it is important? Important is the acetyl group is there. That's why we call it as chemically as acetyl salicylic acid. Now this, when we prescribe or administer the aspirin, this acetyl group detaches from the aspirin and it is attached with the cyclooxygenase enzyme, and we call it as the acetylation of the cyclooxygenase enzyme. Now this cyclooxygenase enzyme is now acetylated. Acetylated का मतलब ये है कि its chemistry is being changed. It's now no more cyclooxygenase enzyme, but it is acetylated cyclooxygenase enzyme. So it could not act on the arachidonic acid. There will be no attraction between the cyclooxygenase enzyme and the arachidonic acid. So in this way, it could block or inhibit the synthesis of the prostaglandins. So until and unless arachidonic acid is not be acted by the cyclooxygenase enzyme, it will not be converted into the prostaglandins. So this is, and this is common for all the drugs who are going to inhibit the enzyme. Donate something to the enzyme, change the chemistry, getting something from the enzyme, change the chemistry, and the substrate of the enzyme is totally being changed. Okay. Now we are at the adverse effect. Adverse effects of this aspirin or the all collectively non-steroidal anti-inflammatory drugs. Again, they are by inhibiting the prostaglandins. Reference point is same. वो change नहीं होगी, because mechanism of action is the COX inhibition and inhibition of the synthesis of the prostaglandins. Prostaglandins normally synthesized in our body. Is normally synthesized in our body. When something is normally synthesized in our body, it means there is some normal physiological function or functions of that prostaglandin. Okay. When you inhibit the synthesis of prostaglandins, you will interfere those normal functions of prostaglandins as well. And when the normal functions of the prostaglandins, they are being inhibited, then they create the adverse effects or the unusual, unrequired effects. Because now you are going to inhibit the normal physiological functions of the prostaglandins. अब कैसे? Yes, come on. अब इसको देखना. दिस इज द स्लाइड, ये आपके बुक में भी है। कोई भी चीज मैंने, काफी चीजें ऐसी हैं जो आई हैव क्रिएटेड बाय माय ओन कॉन्सेप्ट्स, बाय द एक्सपीरियंस, but the majority they are from the books, different books. My presentations, my lectures, they are the concentrated material of different 4, 5, 6 books, and it's all concept, no cramming. Somebody is talking about sir, share the slides. But why should I share the slide? What is inside in my slides? There's nothing written material in my slides, so it's better to go for the YouTube presentation that is complete in a lecture form that could be helpful for you. Okay, so let us talk about, yesterday somebody was talking about, sir, they have the effect on the kidney, so they produces the diuretic effect. So beta, they are acting on the kidney, but they have no diuretic effect. Those conditions, I'm going very slow because this is somewhat very technical. I'm sorry. Those conditions in which leads to decreased blood flow. In those conditions, these drugs, all these drugs, that is non-steroidal anti-inflammatory drugs, they causes the problem. What is the problem? That some, for example, this is the renal disease. This is, yesterday somebody was talking about kidney problem, that is the renal disease, or there is a cardiovascular disease. अब renal disease में क्या होता है? Definitely there is renal blood flow decrease हो जाएगा. There is a decrease in the renal blood flow. Cardiovascular disease में क्या हो गया? That again there is decreased blood supply, so to the kidney, so there is decreased renal flow. Cirrhosis of the liver में क्या होता है? Again there is decrease in the blood volume, because all this synthesis of this different type of blood cells, they are by the liver. So the cirrhosis of this liver or the nephrosis, it again decreases the blood volume. And all these conditions, I'm not going in the clinical conditions of these, so just I'm talking about broadly the renal disease and the cardiovascular disease, and there is the cirrhosis and all these things. They decreases the renal blood flow, they decreases the renal blood flow, they decreases the blood volume. When the blood volume decreases, or when the renal blood flow decreases, again there is the feedback systems, they are being generated to release the vasoconstrictor, because to maintain the blood supply, if there is decrease in the blood flow, so definitely we have to support the blood supply by vasoconstriction. Okay, by usme you create the blood pressure inside the vessel, that's why the blood is being supplying to the area normally. So there is the feedback system that it causes or it releases some vasoconstrictors, which causes the vasoconstriction. When there is the vasoconstriction is there, we don't want the vasoconstriction. When there is the vasoconstriction, again, in response to this vasoconstriction, there will be the synthesis of the prostaglandins. There will be the synthesis of prostaglandins in response to vasoconstriction to causes the vasodilation. When in this condition we use the anti-inflammatory drugs, which definitely act on the synthesis of the prostaglandins, so you are going to abolishing the vasodilation which is being produced in response to this vasoconstriction. So this vasoconstrictor causes the excessive vasoconstriction, and it might causes the infarction. It might cause the renal infarction, it might cause the cardiovascular infarction. So this is one of the side effects, that you are going to abolish the feedback system, that is the synthesis of the prostaglandins. So you are going to abolishing the vasodilation, and you are going to produce the such sort of this problems that is causes the due to the excessive vasoconstriction. Okay, So during acute phase of these diseases, during the acute phase of these diseases, we could not use such sort of drugs. अब ये क्या? What's this? अब मैं आपको इसलिए बता रहा हूँ कि because you are not being exposed. There is the diagnostic tool to visualize our gastrointestinal tract, right from upper part to go down. There is a small, minute fibers attached with the camera. It goes down and it is linked with your computer or your laptop, so you could visualize everything from up to down, 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 and down and down. So you can move these fibers and cameras here and there, and that would visualize every part of this gastrointestinal tract. We call it as the endoscopy. Endo, GIT, scope means visualization. This is called the endoscopy. So what it is, this is the endoscopic picture of the stomach. And this is the normal stomach, and these are the patches, and this is a very large patch, is actually the peptic ulcer. Is the peptic ulcer. This is one of the most important side effects of all these drugs. If you have your own experience, when we get two tablets of the aspirin, Disprin, or 2 tablets of Ponston or the Brufen, we feel the gastritis, burning over here. Burning is nothing. This is the gastritis. And this gastritis is the alarming first symptoms which leads to the peptic ulcer. And this is the very common adverse effect of all these non-steroidal anti-inflammatory drugs. And GIT, you should keep in mind, is that doesn't start from the stomach or from the esophagus. No, it starts from the mouth. So this is the mouth ulcers. What is this ulcer? Or what is this peptic means the ulcer of the stomach? This is the mouth ulcer. We call it as the stomatitis. मैंने कहा था आपको कल, that is जहाँ पे itis आएगा तो this is just sort of inflammation. अब this is the ulcer. हम इसको कहते हैं stomatitis, drug induced stomatitis. That is the gastritis, and which leads to the peptic ulcer. What is this ulceration? है क्या ulcer? अभी आपको बताते हैं कि what is the ulcer. अभी आपको ज़हन में होना चाहिए कि this is one of the most important common side effect of all these anti-inflammatory drugs. That is the peptic ulcer, gastritis, and stomatitis. That is the ulceration of the mouth. अब पहले तो आप ये देखो कि है क्या gastritis or this peptic ulcer क्या चीज है. You are not being exposed to GIT still. ये देखो बेटा, this is the epithelium, gastric mucosa. ठीक. अब ये gastric mucosa भी है, oral tissues में भी आपका epithelium है, definitely. Now this gastric mucosa is a continuous. This is epithelium is continuous. When there is any break in this continuity of the epithelium, we call it as the peptic ulcer or the gastric ulcer or the mouth ulcer. When there is the deficiency in the continuation of this epithelium, it causes ulcer. Okay. What is behind this epithelium? All the nerves and then the blood vessels, they are going to supply the tissues. They are running beneath these epithelium. When this epithelium is broken down, so there will be the exposure of the nerves. क्या होता है stomach में? मेरा ख्याल है you are being exposed to or the structures in your first year biology must be. क्या होता है उसमें? Hydrochloric acid. So what happens when the nerves, they are being exposed due to breakdown of this epithelium? So they are being exposed directly to the hydrochloric acid, and that hydrochloric acid causes the irritation of the nerves, and it creates the pain sensation, and we feel the gastritis and the pain and intense, sometimes a very intense pain is there as far as the gastric ulcer or stomatitis is concerned. And the gastric ulcer, if it is untreated and it's become going worse and the worst, and if when blood vessels they are being exposed, there is the profuse bleeding is there, internal hemorrhage is there. So ये आप क्या देख रहे हो यहाँ पे? What we are going to see on this slide, that this is the mucus, I'm sorry, this is the gastric mucosa, and this gastric mucosa is covered with this yellow line, which is called the mucosa, which is called the mucus. Ye mucus is actually the protection or protective layer between the epithelium and the hydrochloric acid. It prevents the direct contact of the hydrochloric acid with the epithelium. And this mucus is being formed by prostaglandins. The side effects, they are again on or due to the prostaglandins normal physiological function. So when you are going to disturb that normal physiological function, then it leads to undesired adverse effects. So what happens when you are going to inhibit the synthesis of the prostaglandins? Indirectly, you are going to produce the deficiency of this mucus release, and it causes the deficient mucus coat, and then the epithelium is being exposed to the hydrochloric acid, and it causes irritation of the nerves, and it causes the gastritis and the burning sensation. And if this condition persists, it destroys the epithelium and discontinues that part of the epithelium. The part of the gastrium without epithelium is called the gastric ulcer or the peptic ulcer. So this is the whole story. Yesterday, somebody has asked the question. So this is behind the adverse effect, very common adverse effect, that is the gastritis and the peptic ulcer. But it doesn't start from the GIT, it doesn't start from the stomach. If it disrupts the epithelium of the stomach, it again disrupts the epithelium of the oral cavity, and it causes the mouth ulcers, that is stomatitis. अब ये you see, इसको पढ़ लेते हैं थोड़ा सा. These are the types of different pharmaceutical preparations. आपने देखा होगा, because you see, something they are for your curriculum, something is for your knowledge. Because being a doctor, being a health provider, when you are in a community, जब आप सुबह को घर से निकलते होंगे, when you being out from your home for the university, apron लेके, books लेके, so your community recognize you as a doctor. तो उसको नहीं पता कि you are in the first year or you are in the final year. Doctor means doctor. So the community asks the question. जो हमारी कम्युनिटी जो जब किसी डॉक्टर को देखती है तो उसको पेट में दर्द तो वैसे ही शुरू हो जाता है, सवालात वैसे ही शुरू हो जाते हैं. तो sometimes something is not for your curriculum, sometimes it's for your experience and your knowledge. आपने देखा होगा, sometimes there is a weird type of the drugs, like if you have an experience of Aspirin. Aspirin is a very brittle type of crude tablet. उसका काम ये होता है, what when we get such sort of a drug, it goes inside the stomach to the oral route of administration. It disintegrates in this middle part of the stomach, and then it starts creating the problem right there, and it causes the gastritis. तभी आप अगर if you take the Aspirin after half an hour, you feel the heartburn and acidity type of reaction. So this is because the beard drug is disintegrate at the upper part of the GIT, and it creates, because upper part of GIT has an acidic pH. So again, the pH is acidic, and you are going to problem with the epithelium by inhibiting the mucus formation. So it will create the problem. अच्छा, दूसरी आपने अगर ब्रूफिन देखी हो, if you have an experience of seeing the brufen एक वो beta, raise your, you please put down your hand, and when they write down your question, in the end, I will invite you. You can put 1,000 and 1,000 of the questions. I will respond you, no problem. So if you have an experience to see the brufen, आपने देखा होगा ऐसे like a bunty, एक shiny सी एक coat, this is called the coated tablet, या जो हम Ascard use करते हैं, ASCARD, that is the aspirin, and that we use for the prophylaxis of the क्या कहते हैं prophylaxis of the cardiac patients because it's coated. Ab daily you have to take one tablet daily. So if we go for the Aspirin daily, definitely it causes the GIT problem because it disturbs everything inside the GIT. It causes the gastritis and peptic ulcer. So we use this coated tablets. And what is the function of this coated tablet? That it goes down, first the coat is being disintegrated, and then the drug is being, the tablet inside the coat is being disintegrated in the lower part of the GIT. And now here the pH you know that pH is being changed from acidic to the basic. So with that, those drugs who are coated tablets, they have the least problem with the GIT. So we use the coated tablets if there is some chronic use of these drugs. Okay, चलो अब we will continue with the end. अच्छा, कल मैंने आपको कहा था ये क्या है भाई, अब मैं आपसे सवाल नहीं पूछ सकता. I have no right to ask the question because you are not being exposed. This is called Purpura. Purpura. Purpura again आप पढ़ोगे because you are in the blood module. Purpura is the punctate. Punctate means the dotted, like this. You are going to see over here. That is the dotted. This dotted or punctate bleeding spots is called the purpura. And if it is due to the deficiency of the platelets or the deficiency of platelet functions, then it is known as the thrombocytopenic purpura. ये तो आपको पता होगा ना कि अगर platelets की deficiency हो जाएगी तो the function of that platelet they're being deficient. Function of the platelet is just to plug. If you are going to decrease the number of the platelets, the plugging function is being abolished. If the number is you see the normal, but you are going to inhibit the function by inhibiting the cyclooxygenase enzyme and inhibiting the prostaglandins, that it causes the clumping of the platelets. So you will get this purpuric spores. Again, the very common adverse effect for the prolonged use of such sort of drugs, because you are going to abolish the function of the platelets continuously. That is the plugging. So intravascular plugging. So when you are going to abolish this function continuously, it might produces this purpuric spots, and this is called the purpura. Again, this is a very common side effect. Today I'm just focusing on very common adverse effects, and again they are due to the normal functions we are being of this prostaglandins, which are being abolished by the using of these drugs. अब ये देखो बेटे, what's this? कोई घबराने की बात नहीं. This is nothing. This is called the subconjunctival hemorrhage. There is the conjunctiva at the eye. This is a very transparent type of an, membrane. Between this whitish sclera, there is a transparent membrane. We call it as the conjunctiva. And there is a space between this whitish sclera and the conjunctiva. And all the blood vessels of this eye, they are running through this space. जिसको हम कहते हैं subconjunctival space. Sub means under, conjunctival space means the under the conjunctiva. Conjunctiva is the transparent membrane which is over the whitish area, that is the sclera. So this is called the subconjunctival hemorrhage. Again, this is because of the inhibition of platelet aggregation. They are very minute blood vessels. आपने देखा होगा कभी you have an experience of the red eye, किसी वजह से अगर किसी की eye red हो जाती है तो आपने देखा होगा कि very minute blood vessels, they are you are going to be able to see the very minute blood vessels, and that minute blood vessels, they easily bleed when you abolish the functions of platelets. So this is again, though it's not common, but it is in some patient and some people who have some sort of such blood coagulation problems. अब ये तो हमने कर लिया, we have done with the side effects. We have done the mechanism of action, we have done the clinical uses, we have done the side effects. अब इसी side effect में से you have to extract the contraindication. By contraindication, कल मैंने कहा था those conditions, clinical conditions in which these drugs could not be given at all. अब वहीं से शुरू करो, from the back. Contraindication. If suppose the patient is already suffering from the peptic ulcer or gastritis, already suffering from the peptic ulcer or gas due to some other reason, what could be the reason? I'm not going into the details of the reasons of the peptic ulcer. So if you prescribe the such sort of a drug in the patient already of the peptic ulcer, then definitely you might cause the perforation and the bleeding. So peptic ulcer is the sole contraindication. Sole contraindication means no way is the sole contraindication for the use of the non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, number one. Number two, again, this is stomatitis. Already the patient having the stomatitis due to some reason, we could not get the risk and chances of prescribing these drugs. Again, you will aggravate the problem. Okay. What is another side effect? Another side effect is the purpura. If the patient already having the blood coagulation problem, and if you administer or prescribe such sort of a drug, again, you will aggravate the problem and it might cause the profuse bleeding and the hemorrhage. So these are all the side effects, and you could extract the contraindication from the side effects. Effects are effects. Effects are totally depending on the mechanism of action. Whatever the drug is, not only this non-steroidal anti-inflammatory drug. You should keep in mind, isn't it, all the effects, they are depending on the mechanism of action. If you understand the mechanism of action, your pharmacological effects are very much clear. From those pharmacological effects, the desired effects, they are indications. Undesired effects, they are side effects. From the side effects, you will extract the contraindication, in which condition the drug could not be used at all. This is the whole pharmacology. This is the whole pharmacology. What is the problem? I don't know. If you have got any problem, just we'll discuss later on. So this is the subconjunctival hemorrhage. अब ये condition contraindication इसलिए नहीं है. Why it is not contraindicated? Because usually there is no such sort of the subconjunctival hemorrhages. If again the person is having some coagulation problem, then it causes the subconjunctival hemorrhage. So we have discussed in the purpura that if the patient is already having the coagulation disorders, then we could not use such sort of method. 3-4 contraindication, 3-4 side effects, 2-3 clinical uses अगर आपने दे दी, mechanism of action आपने दे दिया, तो I think it's more than enough. कोई भी, nobody will expect much from you people. If you want to reply, then definitely the examiner will love to ask and go to the limits. अच्छा, अब ये क्या, what's this? Salicylism. क्या दिमाग में आता है? मैंने आपको कहा था, I have told you that अगर किसी भी drug के आप, you could not memorize the chemical names, you should memorize the chemical name of aspirin, because this is very important. I could get the advantage because it's 11 o'clock, but I think there's no class, so I can take a few minutes more. So salicylism में आपको ज़हन में आती है aspirin, because its chemical name is acetyl salicylic acid. So this is salicylism. Up, this is the difference between the adverse effect and this is a toxic effect. This is not the adverse effect. This is the toxic effect of aspirin. That's why it is under the heading of the salicylism. It has nothing to do with the ibuprofen, nothing to do with indomethacin, nothing to do with the mefenamic acid, nothing to do with the paracetamol, nothing to do with the phenylbutazone. किसी भी drug से salicylism का has no connection at all. It is the toxic effect of acetyl salicylic acid. And what is the difference between the adverse effects, side effects, and the toxic effect? That adverse and side effects they are undesired effect at the normal therapeutic dose. जो आपका normal therapeutic dose है उस पे जब आप you will administer the drug and it causes the undesired effects, they are called adverse effect of the side effects. But if the dose is very high, if you take the 10 tablets of the aspirin, then it doesn't causes the adverse effect, it causes a toxic effect that could be lethal to that particular person. And the toxic effect of the acetyl salicylic acid is known as the sericilazine, is known as the sericilazine. अब टॉक्सिसिटी में क्या होता है? टॉक्सिसिटी में जो भी whatever the undesired effects are, they are being aggravated. They are being aggravated. So what? Ringing ears, कानों में शहनाई बजती है बेटा, ringing ears. अब ये अगर this is I very love to show this slide in the face-to-face classes, because everyone enjoys such sort of slides, but unfortunately we are not in because of their excessive heat and the exhaustion of the excessive heat. मैंने आपको कहा था is due there will be the vasodilation, and when there isn't a vasodilation, there is the extra pulsation. एक्स्ट्रा पल्सेशन जब होगी तो आपने देखा होगा दिस इज द राइट वे कि किसी को भी आप बताओगे सर में दर्द है तो दिस इज द वे, बिकॉज देयर इज द एक्स्ट्रा पल्सेशन ऑफ द टेम्पोरल वेसल्स. सो जब टेम्पोरल वेसल्स की एक्स्ट्रा पल्सेशन होगी then it causes the headache, and this is the reason behind the very intense headache due to the toxic levels of the aspirin. Of the drug which causes the gastritis and the peptic ulcer, and if you have taken in a very large dose or the amount, definitely it causes the sick to the stomach, and it is very intense sick to the stomach. Shadid the pain and the gastritis and the acidity is there. So these are the very simple and the common symptoms which leads to the sericilazine. If you are being exposed to such sort of patient, please ask about drug history. कि आप कौन सी दवाइयाँ लेते हो या लेती हो? And you, if anybody is having the aspirin in a heavy dose, just stop it. This is very important. Today's जो scenario है हमारा आजकल regarding the viral load and viral diseases. अब इसको चीजों को मिक्स नहीं करना, चीजों को मिक्स नहीं करना. If aspirin is contraindicated in children up to the age of 5 years who have the viral infection. बच्चे सिर्फ up to the age of 5 years. अभी जो कोविड का इश्यू चल रहा है उसमें still alhamdulillah बच्चे they are not being involved up to the age of 5 years. So if they are talking about the aspirin in the adults, they have the valid reason, because this COVID virus जो है, coronavirus जो है, it causes the excessive coagulation and formation of same embolism. वही मैंने कहा कि वो embolism जब when it circulates among the blood vessels, जहाँ फंसेगा, when it stuck up, it stops the blood supply and it causes the infarction. Lungs में फंस गया, it causes the lung infarction. Heart में फंस गया, it causes the cardiac infarction. Kidney में फंस गया, it causes the renal infarction. So that's why they use the aspirin is on the top of the list of the drugs by the WHO and NIH, National Institute of the Health Sciences. The aspirin to obviously start because all the deaths are not due to the virus itself, but it is due to the coagulation which is being produced by the virus itself. But this is the story for the children up to the age of the 5 years who have having the viral infection. If you prescribe, this is one of the toxic effect plus it is one of the contraindication. If you prescribe the aspirin to the children up to the age of the 5 years having the viral infection, it causes the Reese syndrome, and this Reese syndrome is very fatal. It can lead to a death. It can lead to a death. So this Reese syndrome में है क्या? cerebral edema, and the edema of liver, fulminant hepatitis. Hepatitis usually acute nahi hoti. It's in a chronic disease. Asta hepatitis. Fulminant means all of a sudden, overnight hepatitis. And this is all due to when we prescribe the aspirin with the children of under the age of the 5 years having the viral infections, and it causes the Rh syndrome. So the children under the age of 5 years should be strictly contraindicated to prescribe the aspirin. Otherwise, you might create a problem of the Rh syndrome. But if anyone has the previous attack of the Rh syndrome, the drug should be strictly contraindicated up to the age of 12 years. अगर किसी को already 5 years की age तक Rh syndrome हो चुका है, there's a history of the Rh syndrome, so you should strictly contraindicate the drug up to the age of 12 years, because again it might get the same problem. अच्छा जी. So this is the